Are you constantly worried about your prostate health? Do you find yourself making frequent trips to the bathroom, especially at night? You're not alone. Millions of men experience symptoms related to an enlarged prostate, also known as benign prostatic hyperplasia, or BPH. It can be uncomfortable, disruptive, and frankly, a bit scary. But what if I told you that some simple changes in your diet could make a significant difference? What if avoiding certain foods could help you manage your symptoms and improve your overall prostate health? Sit down calmly. You need this solution, don't you? Then don't skip. Watch the full video carefully, like, comment, and share it on your social media. I'm here today to talk about something crucial for every man's well-being, your prostate. It's a small gland, but it plays a huge role in your quality of life. And when it starts to enlarge, it can bring a host of uncomfortable symptoms. Many of my patients ask me, "Doctor, what can I do to help my prostate?" And while there are medical treatments, I always emphasize the power of lifestyle changes, especially when it comes to what you put on your plate. Today, I want to share with you 8 specific foods that, from my experience and based on current research, you should seriously consider limiting or avoiding if you're concerned about an enlarged prostate. This isn't about deprivation. It's about empowerment and making informed choices for a healthier you. First on our list, and perhaps one of the most significant, is red meat. I know for many of us, a juicy steak or a hearty burger is a staple, but studies have consistently shown a link between high consumption of red and processed meats and an increased risk of prostate issues, including BPH. The saturated fats and inflammatory compounds found in these meats can contribute to inflammation in the body, which can directly impact your prostate. Think about it. If your body is constantly fighting inflammation, your prostate is going to feel the effects. So, I encourage you to reduce your intake of beef, pork, and lamb, and definitely cut back on processed meats like bacon, sausage, and deli meats. Consider opting for leaner protein sources like fish, poultry, or plant-based alternatives. Next up, let's talk about dairy products. This might come as a surprise to some, as dairy is often touted for its calcium content. However, some research suggests that high consumption of dairy, particularly full-fat dairy, might be associated with an increased risk of BPH progression. The hormones and growth factors present in dairy products could potentially stimulate prostate cell growth. Now, I'm not saying you need to eliminate dairy entirely, but I do recommend moderation. Perhaps switch to low-fat or skim milk, or explore plant-based milk alternatives like almond, soy, or oat milk. Small changes can lead to big benefits. Third, we need to address caffeine. I understand for many of us, that morning cup of coffee is non-negotiable. But here's the thing, caffeine is a diuretic, meaning it increases urine production. For someone already dealing with urinary symptoms from an enlarged prostate, this can exacerbate the problem, leading to more frequent and urgent trips to the bathroom. It can also irritate the bladder. So, if you're experiencing these symptoms, I strongly advise you to cut back on coffee, tea, energy drinks, and even some sodas. Try gradually reducing your intake or switch to decaffeinated options. Your bladder and your sleep will thank you. Following closely behind caffeine is alcohol. Similar to caffeine, alcohol acts as a diuretic and can irritate the bladder and prostate. It can also disrupt your sleep, which is already a challenge for many men with BPH due to nighttime urination. Excessive alcohol consumption has been linked to worsening urinary symptoms. While I'm not suggesting complete abstinence for everyone, I do recommend limiting your alcohol intake, especially in the evenings. Pay attention to how your body responds. You might find that even a small reduction makes a noticeable difference. Fifth on our list are highly processed foods. This category is vast, encompassing everything from fast food to packaged snacks, sugary cereals, and ready-to-eat meals. These foods are often loaded with unhealthy fats, refined sugars, excessive sodium, and artificial additives. All of these ingredients can contribute to systemic inflammation, oxidative stress, and weight gain, all of which are detrimental to prostate health. I always tell my patients, if it comes in a box or a bag and has a long list of ingredients you can't pronounce, it's probably best to avoid it. Focus on whole, unprocessed foods as much as possible. Your body, including your prostate, will thrive on real nutrition. Sixth, let's talk about excessive sodium or salt. While a certain amount of sodium is essential for your body, most of us consume far too much, primarily from processed and restaurant foods. High sodium intake can lead to fluid retention, which can put additional pressure on your bladder and worsen urinary symptoms associated with BPH. It can also contribute to high blood pressure, which is another risk factor for prostate issues. So, I encourage you to read food labels carefully, choose low-sodium options, and season your food with herbs and spices instead of relying heavily on salt. Your taste buds will adjust, and your prostate will be happier. Seventh, we have spicy foods. For some men, spicy foods can act as a bladder irritant, leading to increased urinary urgency and frequency. While this isn't a universal trigger, if you notice your BPH symptoms flaring up after a spicy meal, it's worth experimenting with reducing your intake of chili peppers, hot sauces, and other fiery ingredients. Listen to your body. It often tells you what it needs and what it doesn't. Finally, let's consider trans fats and hydrogenated oils. These unhealthy fats are commonly found in fried foods, baked goods, and many processed snacks. They are known to promote inflammation throughout the body, and chronic inflammation is a key player in the development and progression of many chronic diseases, including prostate enlargement. I urge you to check ingredient lists for partially hydrogenated oils and avoid products that contain them. Opt for healthier fats like those found in avocados, nuts, seeds, and olive oil. Now, I know this might seem like a lot to take in and perhaps a bit overwhelming, but remember, this isn't about perfection, it's about progress. Even small, consistent changes can have a profound impact on your prostate health and your overall well-being. I've seen it time and time again with my patients. Start by picking one or two areas where you feel you can make a change and gradually incorporate more healthy habits into your routine. It's a journey, not a sprint. Beyond just avoiding these foods, I also want to briefly touch upon what you should be eating for a healthy prostate. Think about a diet rich in fruits and vegetables, especially those high in antioxidants like berries, leafy greens, and tomatoes. Incorporate healthy fats from sources like fatty fish, salmon, mackerel, nuts, and seeds. Whole grains, legumes, and plant-based proteins are also excellent choices. A Mediterranean-style diet, for example, is often recommended for its anti-inflammatory properties and overall health benefits, including for the prostate. Remember, your prostate health is an important part of your overall health. Don't ignore the signs and symptoms. If you're experiencing urinary issues, please consult with your doctor. This video is for informational purposes, and it's not a substitute for professional medical advice. However, I truly believe that by making conscious dietary choices, you can play an active role in managing your prostate health and improving your quality of life. It's about taking control, feeling better, and living a fuller, more comfortable life. I hope this information has been helpful and empowering for you. I'm passionate about helping people take charge of their health, and I believe that knowledge is the first step. If you found this video valuable, please give it a thumbs up, share it with someone who might benefit, and leave a comment below. I love hearing from you and learning about your experiences. Your feedback helps me create more content that truly serves your needs. Thank you for watching, and here's to your health.